Hello, dear friends. Welcome to Elderly Health Guide Years. If you like our content, don't forget to hit the subscribe button and help our channel continue to grow. Thank you very much for watching. Best foods for arthritis and joint pain. Arthritis and joint pain affect millions of people worldwide, causing discomfort, limiting mobility, and reducing quality of life. These conditions aren't just about aches and pains. They can lead to severe complications like joint damage, disability, and even systemic issues. Did you know that over 50 million adults in the U.S. alone have been diagnosed with some form of arthritis? It's not just an older person's problem. Arthritis can affect anyone, regardless of age. And here's the kicker. Many of the contributing factors to joint pain, like inflammation, can develop silently, showing no obvious symptoms until it's too late. That's why taking natural precautions early on, such as incorporating the right foods into your diet, is essential for preventing further damage and improving joint health. Now let's explore the 7 best foods for arthritis and joint pain. These foods aren't just tasty. They're packed with the nutrients your body needs to support healthy joints, fight inflammation, and reduce pain. One of the most crucial components in managing arthritis and joint pain is the diet you choose. Research has shown that certain vitamins, minerals, and compounds found in specific foods can actively help protect and strengthen your joints. First, let's start with whole grains. A surprising yet powerful food for joint health and reducing inflammation. Whole grains like oats, quinoa, brown rice, and whole wheat are packed with nutrients that support your overall health. While directly combating the chronic inflammation linked to arthritis and joint pain, whole grains are rich in fiber, which plays a key role in reducing levels of C-reactive protein, CRP, a marker of inflammation in the body. The American Heart Association highlights that people who consume high-fiber diets, often rich in whole grains, have a 10 to 19% lower risk of systemic inflammation, which is a major contributor to arthritis pain. Furthermore, elevated CRP levels are often seen in individuals with rheumatoid arthritis and other inflammatory conditions. A study found that individuals who consumed 3 or more servings of whole grains daily had 25% lower levels of C-reactive protein, CRP, compared to those who ate less than 1 serving per day. Additionally, whole grains provide magnesium, a mineral essential for muscle relaxation, healthy bone density, and inflammation regulation. Magnesium deficiency is surprisingly common and can worsen joint stiffness and discomfort. Whole grains offer a steady supply of this vital nutrient, helping to keep joints flexible and pain-free. Another standout feature of whole grains is their ability to support a healthy weight. Being overweight adds extra strain to your joints, with each pound of excess weight placing about 4 pounds of pressure on your knees. The high fiber content in whole grains helps you feel fuller for longer, reducing the likelihood of overeating and promoting weight management, an essential factor in reducing joint pain. Contain B vitamins, particularly B6, which help reduce inflammation and improve nerve function, contributing to overall joint comfort. These vitamins also support energy metabolism, making them a great choice for maintaining an active lifestyle, even with arthritis. Whole grains are also crucial for bone health. A study published in Osteoporosis International showed that people who consume higher amounts of whole grains have a 25% greater bone mineral density. This is important for those with arthritis, since stronger bones help support the joints and reduce the risk of fractures or further joint damage. Including whole grains in your diet is simple. Swap refined white bread or rice for whole grain versions. Start your day with oatmeal or use quinoa as a base for salads and stir-fries. Now, let's look into leafy green vegetables, a true superfood group when it comes to joint health. Spinach, kale, broccoli, and collard greens are packed with nutrients that not only strengthen your body, but also combat the inflammation responsible for arthritis and joint pain. These greens are more than just salad ingredients. They're natural shields for your joints. One standout nutrient in leafy greens is vitamin K, which plays a critical role in bone health. Vitamin K helps regulate calcium in the body, ensuring that it's deposited in your bones rather than your joints, where it could cause stiffness and pain. Studies have found that people with low vitamin K levels are more likely to experience joint degeneration and osteoarthritis. For example, research published in the American Journal of Medicine showed that individuals with adequate vitamin K intake had healthier cartilage and fewer joint issues as they aged. Leafy greens are also brimming with antioxidants, particularly vitamin C and E, which work together to neutralize free radicals, unstable molecules that can damage cells and worsen inflammation. Vitamin E, for instance, has been shown to directly protect the joints by reducing oxidative stress, which is a key driver of arthritis. Meanwhile, vitamin C boosts collagen production, maintaining the strength and elasticity of cartilage, which cushions your joints. A particularly exciting compound found in cruciferous greens like broccoli is sulforaphane. This powerful phytochemical has been shown to block enzymes linked to joint destruction and osteoarthritis. In fact, a study from the University of East Anglia discovered that a diet rich in sulforaphane could slow cartilage damage and even protect against the onset of osteoarthritis. The researchers called it a natural defense for your joints. Another benefit of leafy greens is their high magnesium content, which helps relax muscles and maintain healthy bone density. Magnesium also regulates inflammatory markers in the body, reducing stiffness and improving mobility. Surprisingly, studies have shown that many people, particularly those with arthritis, don't get enough magnesium in their diets, leading to exacerbated joint pain. Adding leafy greens to your meals is easy and versatile. Add spinach to your smoothies, toss kale into soups, or sauté broccoli with olive oil for a delicious side dish. These vegetables are low in calories and high in fiber, making them ideal for weight management, a critical factor for joint health. After all, every pound of extra body weight puts about 4 pounds of additional pressure on your knees. By enjoying more leafy greens, you're not just nourishing your body. You're actively protecting your joints from inflammation and degeneration. Let's talk about fatty fish, a nutritional powerhouse when it comes to joint health. Fatty fish like salmon, mackerel, sardines, and tuna are loaded with omega-3 fatty acids, which are renowned for their powerful anti-inflammatory properties. Inflammation is a major factor in arthritis and joint pain, causing swelling, stiffness, and discomfort. What makes omega-3s so effective at reducing inflammation is their ability to influence the production of certain molecules in the body. These molecules, called IOSO, can either promote or reduce inflammation. Omega-3 fatty acids help produce iosoids that have anti-inflammatory effects, which can effectively reduce the swelling in the joints and prevent further damage. In addition to reducing inflammation, omega-3s can significantly improve joint mobility. Research has shown that individuals who regularly consume omega-3s experience less joint stiffness, which is a common symptom of arthritis. There is more. What makes fatty fish even more impressive is their ability to lower levels of C-reactive protein, CRP, a marker of inflammation in the blood. Elevated CRP levels are often found in people with arthritis, and studies have shown that consuming omega-3 rich fish can significantly lower these levels. In fact, research found that people who consumed fish regularly had less joint swelling and tenderness compared to those who didn't. But that's not all. Fatty fish is also a rich source of vitamin D, another key nutrient for joint health. Vitamin D helps the body absorb calcium, which is essential for maintaining strong bones. Deficiency in vitamin D is surprisingly common, especially among people with arthritis, and it has been linked to increased joint pain and a higher risk of developing osteoarthritis and rheumatoid arthritis. The benefits of fatty fish extend even further. Omega-3s in these fish have been shown to improve blood flow, which is vital for delivering nutrients to your joints and reducing stiffness. They may also help slow the progression of arthritis. A study involving rheumatoid arthritis patients found that omega-3 supplementation reduced the need for anti-inflammatory medications by up to 33%. That's a game changer for anyone looking to manage their symptoms more naturally. Incorporating fatty fish into your diet is simple and delicious. As recommended by health experts, aim for at least 2 servings a week. Whether you grill salmon for dinner, enjoy a tuna salad for lunch, or add sardines to your snacks, you'll be giving your joints a much-needed boost. Next up, we have turmeric, the golden spice that's been celebrated for centuries. Not just for its flavor, but for its powerful medicinal properties. The active compound in turmeric, curcumin, is one of nature's most potent anti-inflammatory agents. What makes curcumin so effective is its ability to block several inflammatory molecules in the body, including cytokines and enzymes like COX-2, which are known to promote swelling and pain. This mechanism helps reduce the inflammation that causes the swelling, stiffness, and discomfort often associated with arthritis. In fact, studies have shown that curcumin can be just as effective as some anti-inflammatory drugs, but without unwanted side effects like stomach irritation or increased risk of heart problems. It's like nature's own remedy to fight inflammation with no prescriptions required. What's truly remarkable about curcumin is that it can target the root cause of joint pain, systemic inflammation, rather than just masking the symptoms. Research has shown that regular consumption of curcumin can significantly reduce the levels of pro-inflammatory molecules in the body, leading to a decrease in joint swelling and pain. This makes turmeric a powerful ally for people with rheumatoid arthritis or osteoarthritis, where chronic inflammation is a primary factor in the disease's progression. To maximize curcumin's effects, it's important to enhance its absorption. On its own, curcumin isn't easily absorbed by the body. However, when paired with black pepper, specifically piperine, a compound found in pepper, curcumin's bioavailability increases by up to 2,000%. This means that adding just a pinch of black pepper to your turmeric-rich meals can help your body absorb more of the anti-inflammatory compound, making it far more effective. A simple turmeric and black pepper combo in your dishes, like soups, stews, or curries, can deliver a potent anti-inflammatory punch that benefits your joints. The scientific evidence supporting turmeric's role in managing arthritis pain is abundant. A study published on the use of curcumin for osteoarthritis showed significant improvements in pain and function after just a few weeks of supplementation. Another study involving people with rheumatoid arthritis demonstrated that curcumin supplementation reduced pain and stiffness as effectively as common nonsteroidal anti-inflammatory drugs in SS, but without harmful side effects. While you can definitely enjoy turmeric in its natural form, taking it as a supplement can also be beneficial for those with more severe arthritis symptoms. Let's talk about another fantastic food for joint health: berries. These vibrant, delicious fruits, including strawberries, blueberries, raspberries, and blackberries, are loaded with antioxidants, particularly anthocyanins, which give them their deep, rich colors. These antioxidants play a vital role in reducing oxidative stress and inflammation in the body, both of which are key contributors to joint pain and conditions like arthritis. Oxidative stress occurs when the body's free radicals and antioxidants are imbalanced, leading to damage to cells, tissues, and joints. The anthocyanins in berries have been shown to help combat this oxidative stress, reducing inflammation and pain in the joints. Studies suggest that consuming berries regularly can lower levels of inflammatory markers in the body, leading to decreased swelling and discomfort in the joints. This makes berries not just a tasty treat, but a powerful ally in managing conditions like osteoarthritis and rheumatoid arthritis. What's even more fascinating is that berries may help protect against the progression of joint damage. Research has shown that the antioxidants in berries can help prevent the breakdown of cartilage, which is crucial for joint function. For those dealing with arthritis, this is an important benefit because the degeneration of cartilage is one of the primary causes of joint pain and stiffness. Berries are also packed with other nutrients like vitamin C, fiber, and folate, which contribute to overall health and well-being. Just like vitamin C-rich fruits, they also play a role in collagen production, further supporting joint health and function. Adding berries to your diet is incredibly easy. You can enjoy them fresh, add them to your smoothies, sprinkle them on top of your yogurt or oatmeal, or even bake them into muffins or pancakes. Not only do they taste great, but they also provide a significant boost to your immune system and overall health. For those who don't have access to fresh berries year-round, frozen berries still retain most of their antioxidant content, making them a great option anytime. Let's explore the benefits of olive oil, a staple in many Mediterranean diets and another excellent food for joint health. Olive oil is rich in healthy monounsaturated fats, particularly oleic acid, which has been shown to have anti-inflammatory effects. But what really makes olive oil stand out is its oleocanthal content. This compound mimics the action of nonsteroidal anti-inflammatory drugs, NSAIDs, helping to reduce inflammation similarly but without the harmful side effects. The anti-inflammatory properties of olive oil make it particularly beneficial for people with conditions like rheumatoid arthritis and osteoarthritis. Studies have shown that the oleocanthal in olive oil can help reduce the production of inflammatory molecules in the body, which can alleviate the swelling and pain in the joints. In fact, research has shown that people who consume a higher amount of olive oil tend to experience less joint pain and stiffness. Regular intake of olive oil has also been linked to better joint function and a reduced need for pain medications, making it a natural alternative for managing arthritis symptoms. One of olive oil's key benefits is its ability to reduce inflammation markers in the body. Studies have found that incorporating extra virgin olive oil into your diet can lower levels of C-reactive protein, CRP, a common marker of inflammation. For those dealing with arthritis, reducing CRP levels can help control the pain and prevent further joint damage. Additionally, olive oil contains antioxidants like vitamin E and polyphenol, which protect the joints and help repair damaged tissues, promoting overall joint health. The best way to incorporate olive oil into your diet is by using extra virgin olive oil, as it contains the highest amount of beneficial compounds. You can drizzle it over salads, use it for sautéing vegetables, or dip your bread in it for a simple health-boosting snack. Using olive oil in cooking not only enhances the flavor of your dishes, but also adds powerful anti-inflammatory properties to your meals. For maximum benefits, aim to consume a couple of tablespoons of extra virgin olive oil each day as part of your regular diet. Scientific evidence has consistently supported the use of olive oil as an effective anti-inflammatory agent. A study published on the Mediterranean diet found that individuals who consumed large amounts of olive oil had a lower incidence of inflammatory diseases, including arthritis. The combination of monounsaturated fats and antioxidants in olive oil makes it a perfect addition to a diet focused on joint health. Let's not forget ginger, another natural remedy that has been used for centuries to treat a variety of ailments, including arthritis. Ginger contains powerful compounds like gingerol, which have been shown to significantly reduce pain and inflammation. Gingerol works by inhibiting the production of pro-inflammatory molecules, similar to how nonsteroidal anti-inflammatory drugs, NSAIDs, function, but without the unwanted side effects. This makes ginger a fantastic natural alternative for those dealing with joint pain and inflammation. What makes ginger so effective in managing arthritis symptoms is its ability to target the inflammation that leads to pain and swelling in the joints. Studies have shown that regular consumption of ginger can provide relief from joint pain. In some cases, it may be as effective as over-the-counter anti-inflammatory drugs like ibuprofen. The beauty of ginger is that it doesn't come with gastrointestinal issues, heart risks, or other side effects that many NSAIDs can cause, making it a safer option for long-term use. Additionally, research indicates that ginger can help reduce stiffness and improve mobility in those with arthritis, providing both short-term relief and long-term benefits. One study showed that individuals who consumed ginger regularly experienced a significant reduction in pain and stiffness, as well as an improvement in their joint function. Ginger can also help reduce the need for pain-relieving medications, making it a great complementary therapy to traditional treatments. The scientific evidence supporting ginger's effectiveness in reducing joint pain is strong, with numerous studies highlighting its anti-inflammatory properties. A systematic review of several clinical trials found that ginger supplementation significantly reduced pain and improved function in individuals with osteoarthritis and rheumatoid arthritis. Adding ginger to your diet is easy and delicious. You can add fresh ginger to your smoothies, brew it into a soothing tea, or incorporate it into stir-fries and curries. It pairs well with a variety of dishes, bringing not just health benefits, but also a unique flavor to your meals. Ginger supplements are available for those looking for an even more concentrated form of ginger, but it's always best to consult a healthcare professional before starting any new supplement regimen. So, adding these foods to your diet isn't just about preventing arthritis or managing joint pain. It's about taking control of your health and proactively supporting your body's natural healing processes. Studies show that people who follow anti-inflammatory diets not only experience less pain, but also report a better quality of life overall. Remember, early intervention is key. And the best part is that these foods are not only delicious, but also part of a healthy lifestyle that can benefit your entire body. Start small and gradually incorporate these nutrient-packed foods into your meals to improve joint health and reduce pain. Your joints will thank you. Feel free to leave a comment and subscribe. Your support really inspires us to keep going. Wishing you all the best, stay safe and healthy. See you soon.